Afternoon, it's Dr. Larson at Public Health to talk about our current situation in Kittitas County. We are currently not meeting criteria for being in phase 3. That's really the bottom line. So I'm going to I'm going to answer a question, I'm going to talk about our nursing home outbreak situation, and then I'm going to do some more questions, and I'm going to talk about phase 2 and phase 3. So the first question is probably the most important of all these questions. What are you going to do about the crazy party crowd at Speely Beach? Definitely not social distancing and not masking. It's a disaster. People from the west side are coming here to party and will infect us in the process. So this is really the problem. So not just that particular beach, but the fact that we went from phase 2 to phase 3 and everybody just said, I'm not going to pay attention to any social distancing or masking recommendations, requirements, mandates from the governor. So it put us where we're at. There's a certain amount that we can do in regards to certain beaches. That's the reason that we closed Irene Reinhardt. When our numbers start coming down and we get back into an area where things are safe, I will recommend to Brad Case that we reopen Irene Reinhardt, but right now it's not safe to be open. So our current outbreak situation, we currently have we have cases in all of our long-term care facility. We don't necessarily have residents, so we currently have no residents at 2 of those facilities, and 2 of the facilities that we have mentioned have multiple residents and multiple staff in those facilities. It shows how easy it is for that disease to transmit in those facilities. We had a person die the day before yesterday at Prestige. I tested that person post-mortem. They had a fever prior to their death. I expect that to be COVID-19. We had a patient die who had gone to the hospital for basically end-of-life care that died yesterday. We have 2 patients currently in the hospital that will probably die today. By tomorrow, we'll at least have 3 and maybe 4 people in our community that have died, and we would expect multiple more people that are going to die from those facilities. And how did it get in those facilities? Well, those facilities had done a really good job of maintaining social distancing, of wearing masks, of being careful with personal protective equipment, of hand washing. But as we all got out and about and got into the community and were doing things that were allowed in phase 3, we all got a little bit lax, including healthcare providers, and we brought those back into those facilities. So those diseases just didn't start up all of a sudden in those facilities. They came from the outside. And since we do not have any family members that are currently going into those facilities, it came from us, the healthcare workers. So that's where we're at currently. The numbers are going up. We tested a agricultural facility today, tested 18 people in that facility. We are testing Prestige, acute care and rehab on a weekly basis, all of their negative staff and residents. We will be setting up a cadence to test Pacifica. We will be testing Prestige Hearthstone later this week, and we will set up a cadence to test all residents and staff at Meadows Place as well. So a lot of work there. That work then has been pushed on to KVH. We currently have 2 patients that have COVID-19 in KVH. As I said, those are both end-of-life care situations, but the work is going there, and what you'll see outside of KVH is the tent has gone back up because our numbers are going back up. That is not the direction that we want to go. How many people have tested positive for COVID-19 in Kittitas County are or were asymptomatic? I don't have the exact numbers. I can get those for you by Friday. I'll ask our numbers person that, but it's about 30%. So about 30% asymptomatic. When you really dive in, some of them actually have really mild symptoms. One of the patients I talked to the other day, all that they had lost was a taste of coffee. So that taste for coffee, that is a symptom of COVID-19. Many questions about masking in long-term care facilities, such as with the number of residents at our long-term care facilities that tested positive, can we assume that masks are not providing protection we thought? The answer is no. So if we as healthcare workers are not wearing a mask and a face shield when we are when we see somebody with COVID-19, we are considered exposed to that person because our mucous membranes of our eyes are available for that virus to come in. So at some point, the residents got infected from staff, most likely, and the residents then, some of those residents either refuse or cannot remember to wear masks and give it back. It's hard to wear a mask, for example, when you're in the shower with somebody. So when you're bathing somebody, it's hard for that patient to wear a mask. So masks do work for us in the community. They protect others from us, and they have some protection for us from others. So you can't jump to the conclusion that masks aren't effective. Next one is very interesting. Some state statistics show that Kittitas County has almost as many cases per 10,000 as King County. Why has it been advanced to phase 3? Few people are wearing masks. In some restaurants, even servers are not wearing masks. So actually, we're worse than King County. So when we moved into phase 3, we had to have less than 25 cases per 100,000 over 14 days. We were at that situation. Washington State is now 121.9 cases per 100,000 with a case positive percentage rate of 5.9%. Kittitas, or King County, is at 91.4, so less than the state, and 3.8% positive cases for all the ones that we're testing. And we are currently at 131 cases per 100,000 per 14 days, and that at a 10% case positive rate. We cannot safely open schools with a rate of greater than 5%. So that's the goal, to get less than 5%. We're currently at 10%. To be in phase 3, we have to be less than 2%. Another question about CWU arriving, are they going to bring the disease with them? The answer would be yes. Central is doing a lot of things. I was just on a phone call with Central. They are mandating masking for employees and students. If you're on campus, you have to wear a mask. They're going to be enforcing that. It'll end up being a huge human resources issue for them, but they feel very strongly about that. And so if you're willing to wear a mask, you can come to work. If you're not willing to wear a mask, you can't come to work. So they are really trying hard. We'll have to see how it goes. The next was a long question about chronic disease from COVID-19. So what we know is COVID-19 is a chronic inflammatory disease. It causes a lot of inflammation in the lungs, in the heart, causes blood clotting. All of that inflammation has effect on the lungs especially, but it also has effect on the heart, has effect on the kidneys, has effect on the brain. So what we're seeing is that people, even young people, take a long, long time to recover. And if they recover, they may not ever get back to their normal level of functioning. So a college athlete, for example, that is a cross-country runner, if they get COVID-19, they may not ever get back to the point where they were before. It may take them a season or two to get back to that. So it is not a disease without consequences. A question about bars. So questions about bars. I'm going to take you to the opening, phase 3 opening for the governor. You can address that there. There's information about bars there. And I want to talk about that a little bit, is that we can be more strict than the governor's recommendations than the state recommendations. We cannot be less strict than the state recommendations. So, question about Governor Inslee's announcement about gatherings and of no more than 10 people. Mentions businesses are exempt. Does this mean that a venue can have a gathering of 50 or less for events such as rehearsal dinners, or would it be 10 or less for anything other than a wedding or a religious gathering? So again, it's not very clear from the governor's standpoint. I think it does not make any sense from an epidemiological standpoint to allow groups of people of greater than 10 to get together, which includes weddings, funerals, sports. So in our county, that groups of people less than 10 affects everything. It affects outdoor sports, it affects weddings and funerals. It does not affect churches. And so I'm reaching out to the governor's office to try to get some clarification on that. The choice really is we can do that and see if our numbers can come down, or we can go back directly into phase 2. So again, we do not meet any criteria of going into phase 3 that has to do with numbers of disease. So we still are meeting hospital criteria. We're still barely keeping up on case and contact investigation here at the health department, but we are doing that, but we're not meeting criteria for numbers. And so if we can't get those numbers to go down, the next step is to move back directly into phase 2, or as the governor has said, we may get us another stay home order from the governor. So my ask is for folks to stay home. How safe is it to go to the dentist? I'm 68. So the risk for you going to the dentist is to the dentist themselves. So the dentists do a really good job with personal protective equipment. They have for a long time, actually back to HIV times, and the risk would be low. There's a question about allowing visitors to long-term care facilities even after an outbreak, but close an outdoor park. So this question is really about inconsistencies. So as we started to move forward, we were looking at ways to open long-term care facilities to family members. I spoke to almost all of the family members of Prestige that had positive residents, and almost all of those family members had not seen their families since March. So before we had an outbreak, there was some discussion about opening long-term care facilities to visitors. The current recommendation is only end of life. So if you have a family member in the hospital or at a long-term care facility that's dying of COVID, they will allow you to come in and visit that family member, knowing that it does increase the risk to you some. So I was just over at Prestige today. They were letting a family member in to see one of their family members that were dying of COVID-19. Had another family member call me who had a patient in the hospital, was going in to see them. But we are trying to be as consistent as possible while allowing some businesses to be open. So this gets back to, we should really be in phase 2, not in phase 3. If we as a community are not willing to do the things, masking, social distancing, we will not move forward from where we are, and we will not be able to open schools safely. So there's a question up here about opening schools safely. To open schools safely, our numbers have to be down. The way our numbers are going to go down is if we as a community are willing to wear masks, social distance, and when a vaccine is available, to take a vaccine. I know there's a lot of concern about vaccines. There's a lot of concerns about the fact that we're developing this vaccine very fast. But we as a community are going to have to be willing, once we have a safe vaccine, to take a vaccine. Our ability to move forward and have things like youth sports, weddings, funerals, those type of things are really dependent upon you and us as a community. It's not really dependent upon the health department. So this person said, with all the contraindication, it's no wonder people aren't following the guidelines. I get it. So my guidelines are stay at home, stay in your bubble, go to work if you have to, wear a mask, social distance when you're out in public. Those are the guidelines. And I talked to somebody that was going to have a wedding at the fairgrounds, and I said, in our county, we are not allowing groups of people less than 50. And what I said is, why would you want to have a wedding and infect your whole wedding party with COVID-19? So that's really what happens when we get together. So I'd like to take all those things away and put them till next year. I know I can't do that, but we can restrict social gatherings to less than 10. And we can move back to phase 2, which would then, again, close businesses and those type of things, which, we're wanting to do things safely. It's the getting groups together that's not safe. Why weren't the care facilities in our community already doing weekly testing? There's cost, there's the ability to actually get the testing materials. The Memory Care Center at Pacifica was actually tested June 25th and 26th. They had no cases in their facility at that time. So it doesn't take long to move forward. There's a question about catching flu and COVID-19. It's going to be a real problem in the fall. It's going to be a problem trying to figure those things out in the fall. There's some testing that we can do the test for both of those things, COVID-19 and influenza. There's a rapid test for that. The equipment's not very available, but Central's going to have that. The hospital's going to have that. It's going to be difficult when it comes to testing and quarantining. There's a question about schools and daycares and testing and opening up schools safely. The bottom line was, is total online schooling still an option? Can we open schools safely? A lot of people are looking at opening schools safely. I was just on a call the other day that the CDC is recommending closing school if you have one case of COVID-19 in a school, closing school for 2 to 5 days to kind of try to figure it out. And that if we're doing those type of things, we're not going to be able to keep schools open. We have to be able to protect teachers. We have to be able to protect the people that are cleaning those schools. We want to get kids back into school full time because we realize that students need to learn, and they need to learn in school, especially K through 5. That's the most important. There are a lot of people working very closely on that. If we had to open school this week with the numbers we're at, I would say it's not safe to open school this week. I'm hoping that we as a community can get together and move those numbers down so we can open school safely, but it's going to be hard, and the school districts are working really hard on that. I don't know what the answer is. GNAC, which is the athletic conference at Central, chose not to have sports in the fall. I sent that information off to the school superintendents. Those schools are going to have to think about that as well. A question about guidelines on weddings. And again, the current guidelines on weddings in Kittitas County are, if you have a wedding inside a church or next to a church, you can have a wedding. Otherwise, your groups have to be less than 10. I am working closely with the governor's office on that. I think that's going to be the guidelines coming out of the governor's office. The real reason for doing that is it is not safe to have 250 people at the fairgrounds for a wedding currently in Kittitas County. And the reason we can't do that is because all of us in our community have let our guard down. We've said, it's summer, I'm going to go out, I'm going to hang out with my friends, I'm going to have a barbecue, and thus the people that work in healthcare and other places get COVID-19 and they take them into their facilities. So currently, as of today, the guidelines for groups of people in Kittitas County are less than 10. That is stricter than the state, but it's required until our numbers start going down. So that's what I have in regards to questions today. It's not where I wish that we could be, and my concern is that if we don't, as a community, start to take this more seriously, we are going to move back into phase 2. We will not be able to get kids back to school safely, and this process will go along much longer than it needs to. So please wear a mask, maintain social distancing, be kind to others, and realize that everybody's having a hard time. Thanks a lot. We'll talk again on Friday.